Hello, I'm Dr. Pascarella. I'm here today to talk to you about bunion deformities. Bunion deformities are hereditary deformities that occur in women more than men. The medical term for a bunion deformity is hallux abductovalgus deformity. I have somebody with me today and I'm going to point out a couple of things about a bunion deformity. If we take a look at her foot, you can see where the bone protrudes over on the inside of the foot. We can see where the great toe moves more towards the direction of the little toe. Typically, bunion deformities are painful in shoe gear. However, shoes do not cause the problem, creating the bunion deformity. With bunion deformities, when the big toe moves, there may or may not be pain on motion of the great toe joint. Many times the pain is on the inside of the joint over here, and most of the time the pain is on the outside of the bone where this rubs against the shoe. When we talk about treatment for bunion deformities, there are basically two different ways that we can treat this problem: conservative treatment and surgical treatment. Conservative treatment is wearing shoes that may not rub on the bunion, which would be a wider shoe or maybe a shoe with a lower heel. Anti-inflammatory medications such as those over-the-counter medications like Advil or Aleve, or even a cortisone injection sometimes may help with the bunion if there may be some type of arthritic problem that is associated with the bunion deformity also. So you can have a bunion without arthritis in the joint, and you can have bunions that may have some degenerative changes within the joint also that could be one of the sources of the pain. The other treatment, surgical treatment, there are many different ways to surgically correct a bunion deformity. It depends on how bad the bunion is, determines what procedures are chosen to correct the bunion. Basically, the worse the deformity is of the bunion, the more advanced the procedures are to correct the problem, and the longer recovery time one would have. For example, a simple bunionectomy, if a patient catches it early on, they could be back into a shoe in a couple of weeks. On the other end of the spectrum, when the deformity is more advanced and more is required to correct the problem, you could be off of your foot in a removable cast for up to 8 and maybe even 12 weeks.